In this lesson, you will explore the specific AI tools available to healthcare professionals today. We will look at three groups. First, general-purpose AI assistants like ChatGPT, Claude, and Doximity GPT, which are useful for non-clinical work. Second, healthcare-specific platforms built for clinical workflows, including Ambient Scribes, decision support, and administrative tools. Third, a set of questions you can use to judge whether any tool belongs in your practice. We will finish with a practical starting path so you know what to try first. By the end, you will know which tools to consider and how to begin using them responsibly without putting patient data at risk. Several widely available AI tools help with non-clinical tasks like drafting patient education materials, summarizing research, and administrative writing. ChatGPT from OpenAI is the most widely known large language model. It can draft correspondence, explain complex medical concepts in patient-friendly language, summarize articles, and brainstorm differential diagnoses for educational purposes. The paid version, ChatGPT Plus, offers GPT-4, which shows stronger reasoning on medical questions. One important limit: ChatGPT is not FDA cleared for clinical decision-making. Do not enter protected health information into it unless your organization has a HIPAA-compliant enterprise agreement, such as ChatGPT Enterprise or Azure OpenAI. Claude from Anthropic is known for careful, nuanced responses and strong performance on complex reasoning. It is especially useful for analyzing long documents like clinical guidelines or research papers and producing well-structured summaries. The same PHI rule applies. Doximity, the professional network for physicians, offers Doximity GPT, an AI writing tool built specifically for doctors. It can generate patient-friendly explanations, draft letters to insurance companies, write referral letters, and create patient after-visit summaries. Because it was designed for physicians, its templates and outputs are tailored to clinical workflows rather than general office writing. That matters in practice. A general assistant gives you a blank page, so you have to describe the format you want every time. A tool shaped around physician correspondence already knows what a referral letter or an after-visit summary should look like. If you are a physician already on Doximity, this is one of the easiest places to start because the writing tasks it covers are ones you already do every week. Beyond general-purpose tools, a growing ecosystem of AI platforms is designed specifically for healthcare workflows. The most visible group is Ambient AI Scribes. These tools listen to clinical encounters and generate documentation automatically. Nuance DAX Copilot is integrated with Microsoft and Epic. It listens to patient visits and drafts notes directly into the electronic health record, and it is one of the most widely deployed ambient documentation tools. Abridge is used by health systems, including UC Health and UPMC. It generates real-time summaries of patient conversations, with citations linked back to the transcript so you can check any line against what was actually said. Suki is an AI assistant that handles voice-based documentation and integrates with multiple EHR systems. The second group is clinical decision support. Viz.ai analyzes medical imaging in real time and alerts stroke teams when it detects a large vessel occlusion, which reduces time to treatment. ADOC flags critical findings on CT scans for radiologists and prioritizes work lists based on urgency. Sepsis Watch from Duke Health is a machine learning model that predicts sepsis risk and alerts rapid response teams. The third group is administrative AI, which targets the paperwork rather than the patient. Notable Health automates prior authorizations, patient intake, and scheduling. Olive AI streamlines revenue cycle management and claims processing. Regard analyzes patient charts and suggests diagnoses that might be missing from the documentation, improving clinical capture. Before adopting any AI tool, ask 5 questions. 1. Is it FDA cleared or validated? For anything used in clinical decision-making, check for FDA clearance or de novo authorization. The FDA keeps a public list of AI and machine learning-enabled medical devices. Administrative or educational tools may not need clearance, but should still have validation data. 2. Does it handle protected health information appropriately? If you enter patient information, the tool must comply with HIPAA, and you want a business associate agreement with the vendor. Consumer versions of ChatGPT, Claude, and Google Gemini are not HIPAA compliant by default. 3. What data was it trained on? A model trained mostly on academic medical center data may not perform well in rural or community settings. Ask about training data demographics and validation studies. The last 2 questions are about real-world use. 4. How does it integrate with your workflow? The best AI tool is useless if it adds friction. Look for tools that plug into the electronic health record you already use, whether that is Epic, Oracle Health, or Meditech, rather than tools that need a separate login and manual data transfer. Every copy and paste step is a place where the tool quietly stops getting used. 5. What is the evidence? Look for peer-reviewed studies, or at least published case studies, showing the tool works in real clinical settings. Marketing claims are not evidence. If a vendor cannot point you to anything beyond its own website, that is your answer. Together, these 5 questions separate tools worth piloting from tools worth skipping. Here is a practical starting path. Start with non-clinical tasks. Use ChatGPT or Claude to draft patient education handouts, summarize research papers, or write appeal letters with no protected health information included. Next, if you are a physician on Doximity, explore its AI writing tools for clinical correspondence. Then ask your IT department what AI tools your organization has already vetted and approved, because many health systems are already deploying nuanced DAX or something similar. Attend every training session offered when a tool is rolled out, since understanding its capabilities and limits is essential. And keep a critical eye. Always review AI-generated content before using it, watching for inaccuracies, hallucinations, and inappropriate suggestions. Treat every output as a draft that needs your professional review. Try one of these non-clinical tasks right now, either on the lesson page at FreeAcademy.ai using the interactive prompt playground, or by pasting your own draft request into ChatGPT or Claude.